People in Arkansas just didn't go to the dentist, didn't want to go to the dentist. We still have a lot of people that live out in the Ozarks and the woods, and they just come in for special treatment or whatever if they need it. But now it's all throughout the United States. It's just not Arkansas that's not getting dental care anymore. It's everyone. No one, a lot of people just can't afford it. And the other 50% are too scared to come. I'm a registered dental hygienist and I work for Dr. Timothy Ward. What it is the number one thing is fear. People fear the dentist, they fear the shots, they fear the unknown, because dentistry is, there's not a ton of information on what happens to a tooth when you come in and get it fixed. It's not like you can, you know what's going to happen when you go to the doctor or whatever. And then the cost is, it's never getting cheaper. I've been doing this 26 years. It's gone up every single year that I've been a dental hygienist. And it's a huge cost. By law, that's all you have to have right now is health insurance. So that's the only thing you get a penalty on. You don't get a penalty if you don't have dental insurance. It should be every 6 months. If you're maintaining your mouth, you're healthy, your gums and your tissue is healthy, every 6 months it's fine. Some people have to come every 3 months because they do have active gum disease that I'm only able just to maintain where it's at so that they can keep their teeth longer. But I'd say every 6 months. He sees a whole lot of decay. On the other side, I see a whole lot of gum disease where they open their mouth and all their teeth are actually connected by one huge piece of tartar. They've never had their teeth cleaned. They've never really brushed and flossed their teeth. No one ever taught them. Their parents didn't give them a toothbrush. And I see this all the time, that I actually have to use an instrument that has an ultrasonic vibration to break the tartar off the teeth just so I can see the teeth. They're totally covered. Basically, just one gum disease. It's called periodontal disease. And what happens is the tartar that builds up on the teeth that people don't have removed every 6 months, 3 months, or whatever, it'll let off some toxins that'll actually destroy the tissue and the bone that holds the teeth in the socket. So the teeth become elongated, or some people look like they have really long teeth. Well, they don't. The tissue and the bone has gone down, and so they just have a very tip of their tooth left in there, and those teeth will be really loose, and that's a really short explanation of what gum disease is. Gum disease doesn't go away. Once you have it all the time. I can maintain it where it's at, but once you have it, you have it. You can kind of stop it in its tracks where it's at and maintain it right where it's at, and you can keep your teeth for a lifetime. But sometimes people come in and I say, I'm sorry, there's nothing we can do now. Come in and they're like, okay, I got my tax return back, I want to get all my teeth fixed. Well, you've been getting your tax return back for the last 30 years. You should have thought about that. Yeah, now it's too late. You're going to get dentures with your tax return. Nothing you can do.
Don't wait.
Yeah, don't wait. Wait on death or taxes. Mountain Dew, Dr. Pepper, 23 tablespoons of sugar is the equivalent of, that's in a can of that. And then you mix in, we have a huge methamphetamine community here. I don't know if it's because we're more out in the woods or there's more places to hide and do this or whatever, but that ruins the teeth too. And so we have just a crazy amount of decay and a crazy amount of gum disease because you got, two different groups of people doing, this group isn't brushing and flossing and they've never gone to the dentist. This group over here is bathing their teeth in sugar all day or methamphetamine and have a huge amount of decay. So you got gum disease over here, huge amount of decay. Dentistry will never go out of business, ever. The best part about my job is I'm not bored. I'm not working in a factory where I'm constantly doing the same thing over and over and over and over. Every day is different. Every patient is different. I clean every patient differently than I did the last. There's no two cleanings the same. So I might have gum disease at 11 o'clock, and at 12 o'clock I've got a great set of teeth that that really don't need anything. Well, if you were only going to brush or floss, let's say you say I'm only going to do one. I'm not doing both of them. No matter what you tell me to do, I would rather you floss. You would keep your teeth longer if you only floss your teeth than if you only brushed your teeth. We do things that are called nature's toothbrush, biting into an apple, biting into a sandwich. When you do that, that pressure pushes the plaque up off the teeth. So do have a little bit of natural cleaning during the day, but at no time does that apple floss in between the teeth and get the debris out between the teeth that causes the decay. So you'll have terrible breath if you don't brush your teeth. But if you only wanted to do one and you floss, you would keep your teeth for a lifetime.